Good morning. Welcome to our Drama for Brain Health webinar to delegates from all over the UK, the Republic of Ireland, Australia, France, Austria, Germany, and the United States and Singapore. There are over 200,000 new cases of dementia in the UK each year, as yet incurable, a terrifying prospect, a third more undiagnosed. Their symptoms can be eased and confidence maintained if people are empowered to engage in weekly arts and well-being activity to preserve their brain health and resilience in the community. You will hear how effectively and enjoyably drama, the subject of our webinar today, engages people's imaginative and social skills. Creating characters, working together to create scenarios is a truly engaging way to relieve the loneliness, fear and trauma people feel in the period leading to diagnosis of a potential dementia. Because our aim is to enable support at this vulnerable stage, we do not debate post-diagnosis, for which arts are well established, but on drama models for elders and the social prescribing route from the surgery to drama programs to preserve brain health. Today, we seek to show you various models for drama as creative aging, which nevertheless, due to training in mild cognitive impairment and early stage dementia, can be continued post-diagnosis. Sorry, can someone let everybody? And how through social prescribing link workers, GPs, patients' first port of call with potential symptoms, can refer patients at the outset of symptoms through their social prescribing link workers to local drama opportunities to protect against cognitive decline, loneliness, depression, relieve strain, encourage ingenuity and self-expression, and as we all feel today, bring a joyful sense of camaraderie and accomplishment. I should like to add, as founder of Arts for Dementia, that drama post-diagnosis is vital too, and it is valuable to know that all the theatres involved today also run programmes for dementia post-diagnosis. Indeed, we warmly welcome the UK's leading drama for dementia expert, Nikki Taylor, whose dementia-friendly performance guide we shall make available with the webinar transcript. We warmly welcome and are extremely grateful to our speakers, Dr. Sheila McCormick, Senior Lecturer, BA Programme Leader in Theatre Performance at the University of Salford. She's also the author of Applied Theatre Creative Aging. We welcome Andy Barry, Elders Company Producer at the Royal Exchange Theatre in Manchester. David Workman, Head of Participation, Elders Company and Encore at Southwark Playhouse in London. Machtel Durik, Older People's Programme Manager at Leeds Playhouse. Jenny Marshall, Head of Member Experience, and B. Boswell, Head of Outreach and Support Services for Open Age in West London, where they offer such a broad range, but particularly on drama today. Anna Wolfe, London Arts in Health, Regional Champion of the Culture, Health and Wellbeing Alliance, on how drama organisations notify Culture, Health and Wellbeing Alliance, notify the organisation, as well as who in turn notify regional social prescribing champions. Lisa Jarvis, Senior Programme Manager for South West Social Prescribing Network at the NHS Learning and NHS Learning Coordinator, supporting link workers, the link between Culture, Health and Wellbeing Regional Champions and Learning Coordinator for the Social Prescribing Network, will show how link workers can help spread the word to patients. We are very grateful to Dr. Peter Bagshaw, Clinical Lead for Mental Health and Dementia for Somerset CCG, Demon Clinical Engagement Chair, author of Older Persons Mental Health, a Practice Primer, and Daggers of the Mind. But before handing over to Peter, may I introduce Sir Muir Gray, Director of the Optimal Aging Programme at Oxford, author of Increase Your Brain Ability and Reduce Your Risk of Dementia. It's a Bible, and key advisor to our Arts for Brain Health webinars. Muir. Thank you.
Well, it's tremendously exciting. The evidence is very strong now that we can prevent, delay, slow down, and even reverse, in some cases, dementia. And exactly the same risk factors really are for frailty. And dementia and frailty are the conditions that people fear most. We no longer fear cancer in the same way. It's a long-term condition and very treatable. So to do this, we have to increase activity, physical, cognitive, and emotional. And few ways better doing that than through drama. And we're also thinking a lot about how we can use virtual as well as face-to-face. Obviously, we should try and get people out of their homes, but we're now going to introduce through GP systems ways of reaching people in their own homes. Secondly, we need to think of connectedness, and there are now ways of connecting people. So there must be in care homes or in their own homes 1,251 people who love Hamlet. And maybe 781 people who love Whitehall farces, if you remember Whitehall farces. So these communities can be brought together using the internet to share an experience. And finally, I'd say to you that organizing arts and drama is, for yourselves, a very good way of reducing your risk of dementia, meeting challenges. So very exciting. And I think we're now seeing the move from recognizing the National Health Service is a national disease service, and that's very important to diagnose and treat disease. But well-being is improved by many other interventions, one of which is drama. So looking forward to this morning's workshop, and I'd like to congratulate Veronica and all she's doing to bring together music, drama, pictorial arts, the contribution that the arts can make to living longer better. Oh, Peter, over to you.
Thank you, Muir, and I absolutely endorse what you say. The current evidence is that we can reduce the incidence of dementia by about 40% with lifestyle changes. Now, if you think that there was a drug out which didn't have any serious side effects, was free, and reduced the incidence of dementia by 40%, we would all be taking it. So why aren't we doing these lifestyle changes? Part of it is around reducing metabolic syndrome, obesity, inactivity, loneliness, but part of it is around cognitive stimulation, which is a nice recommended procedure. I can't think of a better way of being cognitively stimulated than doing arts. Or perhaps this morning by being sent the wrong Zoom link and having to do the right Zoom link at the last minute, which is a deliberate ploy by the organisers of this meeting to improve your cognitive stimulation. So welcome to you all. Our speakers have only got 5 minutes, which is really tough because they've put years of work into the fantastic projects that they do, and condensing it into 5 minutes is really difficult for them. And I'm going to crack the whip and make sure we keep to time so we've got plenty of time for questions at the end. So I'll now shut up and hand over to Dr. Sheila McCormick, who, as you've already heard, is Senior Lecturer, Programme Leader in Theatre and Performance, University of Salford, and author of Applied Theatre Creative Agent. Sheila.
Good morning. Thank you, Peter. I think it probably would be helpful for me to give some context to what applied theatre is and how it differs in this area than it does potentially in other areas. So applied theatre, which many people attending will know, is a practice of making work with, for, or by a community, entering into that community as a visitor, knowing very clearly that you are a visitor and that you're not a member of that community, and offering an opportunity to make with, or for, or by work. I think the difference between applied theatre in this particular area and applied theatre in, say, prisons or in schools is that this form of applied theatre is very much about affect. It's about pleasure, sociality, engagement, community, spending time with another individual, as opposed to potentially learning something, although that can be something that comes as an aside. Sorry, I thought that was somebody asking me to mute. I was like, am I that boring? So I think what would be interesting to think about is what makes this kind of practice slightly different from other types of practices. And I think it is about addressing issues that relate to dementia, but also issues that relate to aging, social isolation, marginalization, ageism, a sense of other in society and being other, which is, I was thinking about last night, which is an unusual aspect to think that we will all age, and yet we seem to to hold people who age aside from ourselves, certainly in our youth and our middle age. So what I'm interested now is looking at sort of interdisciplinary practice. I've moved on to look at areas around death and dying and attitudes towards death and dying, but I'm also really interested in intergenerational practice, and not necessarily just young people with old people, but also middle-aged people with older adults, and young children with older adults. So we become a more inclusive society, and then these kind of issues that we're talking about become less othered and very much part of the conversation as we grow old ourselves. I think that's probably as much as I can say at the moment, unless you want me to keep going or hand over to somebody else.
No, that's great. If we can get ahead of time so we've got plenty of time for questions, that's absolutely fantastic. So thank you very much, Sheila, for getting that in under the 5 minutes.
Thanks, Peter.
So I'm now going to hand over to Andy Barry. He is the Elders Programme Producer at the Royal Exchange Theatre in Manchester. Andy.
Thank you. Well, I'm under pressure now to go really to time or even under. I've got a short presentation that I'm going to share. So hopefully, can everybody see that on screen? Great. So it's great to be here. Yeah, as Peter said, I'm Andy Barry, I'm the Elders Programme Producer at the Royal Exchange Theatre, and I'm also a theatre director. And at the Royal Exchange in Manchester, we've got quite an established Elders company, which has also developed into a wider Elders programme. And I guess the overarching aims are to promote creativity into later life and encourage that. As we all know, it's a powerful tool to help people feel valued, and to feel energised and to have a sense of purpose as well. And also a sense of joy. I think that's really important. And the Elders is also about challenging ageing stereotypes, which Sheila tapped into a bit there as well. Not just in wider society, but also in individuals, because often those stereotypes are kind of internalised. So at the Exchange, we have a company model, which is a year-long journey that people take part in. And it's for people over 60. And at the end of that year, those people become graduates. So we continue to work with them, and they engage with us regularly in different ways, including joining our Elders Leaders programme, which is a leadership programme. We also have a regular public day long programme of activities called Elders Mondays, which take place twice a month. And that includes play reading, play writing, and practical drama sessions. And we also do a lot of intergenerational work with our young company. So we found ways to kind of try and move people through the programme and to keep challenging them as we do that and stretching them in new ways, but also that makes space for new people who want to become involved. The people that join us are a mix of sort of first timers. I think what we are able to do is create quite safe, supportive spaces where people build confidence and also friendship groups. And I think this experience really helps people as they're aging. It helps them to develop support networks and also build their own personal resilience, which could become really useful in other areas of their life. During the pandemic, we've been challenged to help them remain creative. Some of them, the film that you're seeing, hopefully, if I can get it working, is a mockumentary that we made of a group of older people in Manchester trying to keep their theatre group going. So it was sort of our love letter to theatre. And also at the start of the pandemic and on Zoom, they said that they wanted to be connected, but also try and laugh together. So that was the sort of brief that they set. And as the lockdown progressed, new people have joined and new friendships have formed. A group of our Elders graduates went further, and with support, they started their own daily coffee mornings. And it soon became a creative space. And during the lockdown, they started to produce their own films, which they posted on YouTube. Oops, and that one's got sound, which it isn't supposed to have. So I'll just skip ahead there to the next slide. And they still continue to meet every day, including on Christmas Day. So it's a really great example of how, with a bit of support from us, they can actually then support themselves in a much deeper way than we were able to as an organisation. and they've done that for themselves. They've been creative. They've published their own collection of poetry anthology called Elders Unmuted, which they then sold at a profit for the theatre. So it sort of becomes part of a much bigger ecology. And being together has given them purpose and stretched them in different ways, creatively, technologically, but also some of them have really developed their leadership skills. So these pictures that you're seeing are of the intergenerational work that we do. So as well as making theatre, we create spaces for people from different generations to meet and talk. And this challenges people to think in new ways and to grow and to maybe shift opinion. Some of the photos are for an online project we did, a music project, and then also an in-person piece of theatre that we did last year called Wit and Wisdom, which explored the role of comedy in our lives. And it was fun and joyful, but it also provoked some interesting discussions around race and gender and inclusion, which were really interesting to have intergenerationally. We also did another project, which there is a short film online which you can watch. I'm not going to have time to share that, which was a phone project where we partnered some of our leaders with people living with dementia on the phone to create poetry together. And that was a really nice way of older people supporting other older people. So, and that was called Phone a Friend, and also We'll Be in Touch. So finally, I think the key learning, or hopefully the takeaways from my talk, will be that being part of a company program like this one can develop confidence, resilience, emotional and physical well-being, and it can also be a space where people can belong and celebrate the joys of being alive. Hopefully I haven't gone too long over. Thank you very much for listening.
Thank you, Andy. That's absolutely fantastic. For anyone who's thinking of this and thinks that maybe they're a little bit old to get involved in theatre, we have some wonderful older actors, don't we? A generation of people, Dame Judi Dench, for instance. I was lucky enough to see Syria McKellen skipping up and down steps on stage as a 25-year-old Hamlet recently. So we have some really fantastic older actors. Anthony Hopkins, who played, of course, somebody with dementia recently, very movingly. So get involved. It's never too late to do anything. And on a similar theme, I'm imagining David Workman, who is head of participation at the Elders Company and Encore Southwark Playhouse in London. What a wonderful place, Southwark Playhouse, isn't it? So over to you, David.
Thank you very much. Yeah, thanks for the introduction. Yeah, hello, I'm David. I'm head of participation at Southwark Playhouse in South London, where I'm responsible for all of our programs of working in the community and outreach, but particularly, obviously, today talking about two of our projects. We've got our own Elders Company, which I take a lot of inspiration from the work of Andy for that, and we're part of a network across the country as well with Leeds Playhouse, amongst others. Really, all of our work, much like I imagine everyone else's, is predicated around the belief that art's a kind of a fundamental right, wherever you find yourself in life, whatever age, whatever background, whatever situation, and we kind of bring that to bear in all of our in all of our work. So we have two groups, as I said. Our Elders Company, very similar to the work of the Royal Exchange, is a group that really kind of aims to kind of support older people, kind of 65 and over, to stay active, as a way of using drama to maintain brain health, connections with others, kind of combat loneliness, combat isolation. And much like Andy, we've continued all the way through lockdown. But really, that we use that group. It's been running for 6 years. Many of the group have been with us since the start. They kind of continued. They've built their own connections, their own relationships, and friendships within that. And that for us feels as important as as the work we do. It's those connections, those communities that we build and support. In conjunction with Arts for Dementia, in 2020, we launched Encore, formerly known as Muse of Fire, which was a project for adults diagnosed or kind of awaiting a final diagnosis of early stage dementia, with the aim of kind of using drama as a tool to support memory loss, cognition, kind of maintaining confidence with participants. And again, that's been running since 2020. We ran all the way through lockdown as well. And with that, we had a range of participants, some who came with their partners, some who came with their friends, and it's been great because, again, lots of them have continued with us, and there's kind of clear kind of anecdotal sense of the impact it's had. So we a participant who had a diagnosis of potential vascular dementia has kind of managed to kind of maintain and her reading ability and kind of regain aspects of that, and she's kind of really kind of proud of being able to do that. And I think it's been nice to kind of be able to kind of support her. The work we do with the group, it depends. We do we look at a range of things. We've looked at scripted texts, you know, everything from Shakespeare to contemporary works. We've looked at devising, using our own imaginations, our own ideas around social and political themes. And all of this really, it's about engaging the brain, engaging those processes to kind of support continued engagement and health. And we work with around 45 to kind of 60 older people across all our programs every year. And much like Andy, we've kind of helped develop their leadership skills as well, as, you know, as directors, as writers, as facilitators, and working with younger people as well. So we really kind of try to provide a broad range of opportunities. And we've also worked with in terms of social prescribing, our local link workers, to kind of spread the word about the work. That's an ongoing process, an ongoing kind of relationship building, but we're really keen to kind of to develop that and kind of share the impact of the work with link workers and GPs, so that we can kind of hopefully kind of have people referred to us across all the work that we do. Yes, so that's kind of, in a nutshell, that's kind of work we do and what we're trying to achieve. I'm really pleased to kind of be able to be part of the network with everyone here today, to kind of share what we're doing and hear from the great work of everybody else. But yeah, thank you very much.
Thank you very much, David. And we were talking earlier about the arts and theatre as cognitive stimulation, but you've stressed that it's also about getting people together. And we know, for instance, that loneliness and social isolation is a specific risk factor for dementia. So the work that you and others are doing in bringing people together is fantastic in helping. So I hope people are getting a sense of all the good work that's going on around the country. We're next heading back up north, having briefly gone down to London. We're going back up to Leeds. And Mactel de Rijk, older person's program manager at the Leeds Playhouse. So over to you.
Hello, everybody. It's really lovely to be here. Can you hear me okay? I will try and speak slowly, as I've noticed that there are someone's requested captions and they're not there, but I can talk quite quick. So do please tell me to slow down if that's helpful for you. I have also got a quick presentation. Can we see that? Oh, I can't see anybody else now. Sorry, I'm frozen, but I can't see anything. Can you hear me?
Yeah, we can hear you and we can see your presentation.
Okay, I can't see anything, so I am going to just speak and let me know if that is not working. So good morning, everybody. I am going to talk to you a little bit about the Older People's Programme at the Leeds Playhouse. So the Older People's Programme at the Leeds Playhouse has got a history of about over 30 years. So we started working with older people to create creative opportunities for older people over 30 years ago. We have some members who have been part of the Older People's Programme for 30 plus years. So they started in their 50s and now are in their 80s, which is really exciting. As some of you might know, is that the Playhouse will do lots of work with people living with dementia and people that have got a dementia diagnosis. But Veronica has asked me to kind of talk a little bit about what we do pre-diagnosis and what creative opportunities we have for people to improve brain health. So I'm going to focus on Heydays. So Heydays is a creative arts project, and we have 200 members that come to the Playhouse every Wednesday, and they take part in a whole range of creative arts activities. So they take part in arts and crafts, in drama, in dance, in singing. There's talks, there's discussion groups, there's member-led play reading groups. So it's a really, really busy day on a Wednesday with lots of opportunities. How we are, our drama group is a very generous, inclusive space where people can try drama, or where people can develop their skills in drama. Some terms they perform, some terms they don't, so there's no pressure on that. There's about 30 people in the drama group, so luckily not all 200 at the same time in the drama group. There's about 30 of them. And what is really good about this group is that it's really inclusive of people to just wanting to try drama for the first time, or people who've been part of it for a very long time, have a new challenge every term. We have worked for the last 30 years with social prescribers, or obviously social prescribing was there before the actual role of a social prescriber was in GPs, and we've worked with GPs and memory health support workers into getting people to Heydays and try the drama group. And this has been a really beneficial journey for people because they have tried something new. They found companionship, something that Andy was talking about as well, is that the companionship that people find within the community of that space can be really supportive. It also really helps with kind of the NHS outcomes of improving balance, reducing the risk of falls, isolation, which can all lead to kind of decline in brain health. We don't promise anything like any clinical outcomes in the work, but what we do promise is that we will create an engaging, stimulating environment. And we have seen people who have attended the drama group with mild cognitive decline, and they have been coming for over a decade. But we just support people, and the Heydays membership is really supportive to people as well, which is really important. So, for example, we do dementia friend sessions, we do information sessions for the membership, so that if they have someone that might start to display some symptoms, that it's a really supportive environment and that people can continue to be creative. There's a whole load of other array of work that I could talk about, what we do at the Playhouse, and how people kind of go after they've had a diagnosis, how they go on to co-create our programs for people living with dementia. But I'm running out of time, but I would love to chat to you all more. So if you have any questions or would like to find out more about Heydays or any of the other projects that we run, please do let me know. I'd love to talk a bit more, and I'm happy later on when we've got a bit of a discussion to clarify some things as well. So thank you so much. I hope I can unfreeze now when I stop sharing so I can see all your lovely faces. Yay, I can see you now. That's good. That's much better. Okay, thank you so much.
Thank you. That was fantastic. And a number of people have said about wanting to make links. So I'm sure we'll be happy to share emails and web links and so on at the end of the presentation. I was really interested that you used the phrase brain health, because this is something that's come to the fore in the last year or so, a different way of looking at it, rather than there being this disease caused by tau and so on, called dementia. We look at brain health, which is around the general aging, and Samur was pointing out the links between dementia and frailty, and of course there are links with Parkinson's disease and various other neurodegenerative diseases. And the sort of thing that Machteld and others are describing are a way of boosting our brain health to protect us against the decline that can happen with aging and with other damaging factors. So it's a new way of looking at it, and one that I'm very keen about. It's less stigmatizing. So thank you. Right, next we're going back down into London. We're hopping about the country today. And Jenny Marshall, who's head of member experience for OpenAge, a charity providing group-based activity for those aged 50 plus, based predominantly in West London, is going to speak to us. Over to you, Jenny.
Morning, everyone. Thanks, Peter. So as Peter said, we're OpenAge are predominantly in Northwest London, and we provide a wide range of low-cost, high-quality group-based activities, generally across 4 main categories. They include arts, culture and social groups, physical activity, informal learning and outreach and support services. We are, for those aged 50 and above, just for context, our oldest member is actually 104. And our purpose is to connect those aged 50 plus through shared experiences and new opportunities. And this is also to enable older people to continue to age well, mentally and physically. And of course, not to mention to have fun. Speaking to this audience, in relation to drama, I wanted to talk briefly about some of the work OpenAge has done and continues to work on. OpenAge generally works with a variety of partners, not only to host more opportunities for our members, but equally so they can feel connected to their local community and culture. We worked with the National Theatre as part of the Public Acts programme, one of the 8 founding community partners. This project was about creating extraordinary works of interactive theatre, and it was bringing together community organisations and theatre together as a force for change. The partnership was over about 2 years and included ongoing workshops that led to a production each year. The first year, OpenAge were part of a 200 cast performance that performed Pericles on the Olivier stage at the National Theatre itself. Got very emotional when I saw that one. And in the second year, As You Like It at the Queen's Theatre in Hornchurch. So the idea was the community would go to the theatre and then the theatre would come to a local community theatre the second year. Most of the members taking part have not even considered attending a drama group, let alone be on stage. So it's quite daunting being on the Olivier stage of all places. But many had said that it gave them a purpose or a stage to find their identity and created a willingness to try new things. And actually one member said, I found a family in the theatre. The second project I wanted to mention today was a comedy project in partnership with Imperial College. We wanted to build on the legacy of the Public Acts initiative, where members had found newfound confidence, a project which continued to encapsulate inclusivity, share connections, experiences, and a sense of purpose through OpenAge's self-made community and its partners. We wanted to capture, hone and showcase the comedy writing skills of older local residents, probably a demographic not normally associated with comedy. And participants attended 4 workshops and wrote a 5-minute comedy routine, which they performed at a fundraising event for OpenAge. Members also learned about the science of the brain, science of laughter and science of confidence as part of their journey. Feedback was overwhelming and really positive, and even I was slightly red-faced, slightly shocked when the first member of their opening act joked about a recent sexual experience they had. Didn't quite know where to look with our partners, but they felt that it was an open forum to share that. So it's an experience for us all and a learning curve for all. But what I did want to say, and I know we're very stuck for time today, but OpenAge has seen firsthand how drama has enabled our members to tell their story, express feelings appropriately and form new or improved relationships, and as a result have decreased anxiety and loneliness, thus allow members to age well individually and as part of a newfound community. I wanted to actually introduce my colleague B at this point, because we're aware that we have multiple gateways that come into OpenAge, and I think it's also useful for the audience to know how you can refer into an organisation like ours. So B, if you're there, over to you.
I'll be very quick. So for those people who might not easily make their way to an open age activity, because anybody over 50 can join, it starts for the membership form and away you go. But for those who are isolated, have other barriers to participation, the Outreach and Support Services team acts as a gateway for that. So if you go onto our website, you have support and referrals. Click on that and you have the referral form. But we really do ask for anybody making a referral to actually contact our link up service first, just have an informal chat to make sure that it's the right fit for both, because what we don't want is a bad experience. And that's really all that I want to sort of say on that, because on there you'll see our tailored services under the outreach and support. There's a whole host of things, including a men's programme, creating safe space, lots of activities under there. As well as phone groups and other things. So that's it in a nutshell. Yeah, thank you. Are we in 5 minutes?
Absolutely.
Oh, fantastic.
Thank you very much, Jenny and Bea. And Jenny, you were saying earlier about how people sort of feel well when they're on stage and rise to the challenge. Of course, there's a phrase, isn't there, Dr. Theatre amongst actors, that the fact that you've got to go on stage and deliver however you're feeling can actually improve your well-being and health. So you've demonstrated Dr. Theatre very well to us, I think. Well, we're doing really well for time, so I'm hoping we'll have lots of time for questions at the end, and we'll also share links and emails and so on. So next we're staying in London, and this time we're with Anna Wolf, who's at the London Arts in Health, and she's the Regional Champion, Culture, Health and Wellbeing Alliance. Anna.
Hi, thank you. That was a very lovely introduction. Hi, everyone. So my name's Anna Wolf, and I'm the Interim Director at London Arts and Health. So I thought I've got a very short presentation, but I thought I would just talk about a resource particularly that we've been developing at London Arts and Health to help practitioners. So at London Arts and Health, we are a sector support organisation. So our role really is to connect freelancers, practitioners and organisations with kind of clinical staff, helping to kind of meld all those conversations together to make sure that best practice is happening. So I'm just going to do that good old fashioned share screen very quickly, and I will put some links in the chat as well so that everybody has access to these resources. So what we offer in London, as I said, we're a charitable sector support organisation. We also have a festival called Creativity and Wellbeing Week, which runs every May. And we offer lots of kind of peer support and training. And, I just want to thank Veronica as well and her amazing report. So that's the kind of thing that we promote through our networks and make sure that people have access to best practice and research. We also have a website, newsletter, and lots of online resources. So something that we've been developing for the last year with the GLA, actually, so the Greater London Authority, is a resource called the Arts and Culture Social Prescribing Mythbuster, which is a bit of a mouthful. So what we found is that lots of particularly sort of freelance members of our organisation or lone practitioners or smaller organisations are really delivering brilliant cultural social prescribing activities already, but might be struggling to kind of make that jump into sort of more formal social prescribing avenues. So connecting with local link workers, understanding, what evaluation might need to be provided or how to get referrals. So we built this toolkit in collaboration with lots of organizations. So actually Veronica very kindly kind of consulted on this, and she's actually featured in one of the podcasts. So you can listen to her talking about referrals. So the toolkit is really there for people to kind of utilize, and it contains lots of different links. We're actually also publishing a kind of second iteration of this in March. And again, it's quite London focused, but I will also talk very briefly about the Culture, Health and Wellbeing Alliance, of which we're one of the regional leads for London. So the Culture, Health and Wellbeing Alliance is a brilliant organisation, a national organisation. Again, if you find your regional coordinator, you can, outreach to them and really kind of make those links with local social prescribers and think about the best routes in. So something that we found a lot in London, and we've chatted to lots of different, for example, Thriving Communities projects. I'm sure everybody knows about Thriving Communities now, and social prescribers, is that often they feel quite overwhelmed by cultural organisations, who have amazing offerings, but they need to kind of find ways to like filter and kind of work with people and make sure they're working within any sort of NHS systems, particularly thinking about how you make that referral or how you might do evaluation. So this toolkit is a way to just sort of learn a bit more about that. We also have another tool that might be useful called Partner Up. So this is a way of building creative partnerships. So if you're offering something, a certain practice, evaluation, or whatever it might be, research, you can use our free Partner Up tool to find other kind of like-minded organizations. I'm going to just stop sharing my screen there. So essentially, the other thing that we're always looking for at London Arts and Health and the Culture, Health and Wellbeing Alliance is really good examples of social prescribing or best practice, because that's the kind of thing that we can promote across our networks and our channels. So for example, on Thursday this week, we are strategically running with the GLA and ACE a roundtable. So we have the head of public health for London, we have some cultural organisations, and we are going to kind of host a roundtable thinking about the new ICS structure and how culture is like baked into that offering. How do we ensure that our brilliant, cultural social prescribing projects like what we're talking about today, get commissioned and a part of that mix to keep everybody healthy and happy. So if you're doing that kind of work, please talk to your CHWA regional leads, because they can help to kind of elevate this up the food chain, so to speak. So I'm going to pop a couple of links in the chat, and hopefully this might be some helpful resources and some other people to kind of network and link with in your region. So thank you.
Thank you very much, Anna. That was fantastic. And you mentioned social prescribing, which Veronica mentioned at the beginning, and which leads us on very well into our next speaker. Having been a GP and prescribed pills for 3 decades, I kind of realised rather late in the day that I've been doing it completely wrong, and that I should have been prescribing social prescribing, lifestyle, emotional well-being, self-help, and that would have made a much bigger difference to my patient's health than all these wretched pills that I prescribe them. So, as I say, that takes us very well into our last speaker before our discussion, Lisa Jarvis, who's Senior Programme Manager for South West NHSE Social Prescribing Network. Lisa.
Hi, thanks for that introduction. And I really don't know how to follow all those wonderful presentations that I've just heard. And I'm really inspired, actually, because in my job, I don't get to hear a lot about arts and culture. And it's just, wow, I could listen to you all day. And thank you, Anna, for actually really a nice segue into looking at social prescribing. So my name's Lisa Jarvis. Like you said, I'm Senior Programme Manager for NHS England in the South West region for our personalised care team. And I lead on social prescribing across the whole region. And I'm really just going to talk to you very much about ways that you can start engaging more with social prescribing, with the link workers, with regional learning coordinators, and what's going on in your region to really start growing the ability for people to refer into your services, but also for you to be able to connect the other way as well. So it's a real two-way kind of communication. We work very much with the voluntary and community sector, with our colleagues in Thriving Communities and NASP, and also with the local authorities. So I think what's really important is to say that social prescribing, as Mactel said earlier, isn't anything new. It's been going on for years and years and years. When I started as a youth worker, that's what we did. But actually, it's now been badged by the NHS, and we have social prescribing link workers. But it very much is that collaborative approach between everybody and about how we can support people to really reduce social isolation and find some of the solutions to people's support needs within their local communities, and actually making sure that people can link up with the things that matter to them. And actually some of those things that may have feel like they're in their past or something that actually they haven't been able to connect with a while, social prescribing is a really great way of making sure that people can connect back with arts and culture and the things that really bring them joy, and also, as we've heard, have a massive medical impact. So I think the thing that I wanted to say is that in every primary care network, there should be at least one social prescribing link worker. So that means that every GP surgery should be able to link into one social prescribing link worker. Now, they might be spread across a couple of different surgeries, but actually there's still somebody who is your contact. The best way to get in touch with them is through your local GP surgeries, because as you can imagine, people change all the time, they move around, you know, there's more social prescribers all the time. So we know that some people have 4 or 5 social prescribing link workers. Some are looking at very specialist things. So there might be people who are focusing on social prescribing for older people. Some are working with children and young people. And we've also got armed forces social prescribing link workers popping up all over the place. So contact your GP surgeries, and that's the best place to make contact. If you are struggling, and you can come through me and I can give you the contact, that's not a problem. I will put it in the chat. You can go through your regional learning coordinator. So in every region, there is somebody like myself, so I cover the Southwest, but there is somebody who covers social prescribing and looks at supporting the existing social prescribing link workers, but also being that kind of communication between also what's going on nationally, but also on the ground, what are the innovative things that we can get people linking in with? Because actually also sometimes when we have that what matters to you conversation with people, they don't know what they want to get involved in. They don't know what's possible. So it's really important that the social prescribing link workers know what's available in arts and culture to say, well, have you thought about this or have you thought about that? So actually having that partnership conversation is really important when we're working with people. So just the last thing to finish on is just to say that actually, you know, going back to what Peter said in his introduction to me, social prescribing and engaging people in everyday ordinary activities is absolutely life-changing, and we've seen some amazing outcomes for people. And as David said and Mactel said as well, some of the things that they've seen in their projects are just absolutely fantastic. But we need to get social prescribing link workers and the primary care networks really linked up with what you're doing and really pushing that arts and culture, which has such a fantastic impact on people's lives. So I'll put my contact in the chat, but if anybody wants to know more about social prescribing, please do get in touch. And hopefully I came in on time.
Fantastic. Thank you, Lisa. And thanks to all our speakers. Amazingly, because I think I could have listened to any of you for an hour, and I'm sure you could have talked to for an hour on the things you've done. But amazingly, you've all stuck to your 5-minute brief. Thank you very much indeed, which means we've got plenty of time for questions, which is fantastic. To anyone who hasn't opened up the chat bar, there are lots of links in there, and I'm sure Veronica will share those links after this talk and do a bit of virtual networking as well. So I'd now like to throw it open to the floor. Please feel free to unmute, put yourselves up on video and ask any of our speakers any questions you like. Virtual hands or real hands, or just butt in if I don't spot you. And there's silence and I'm not seeing anybody. I don't know if this is a technical issue.
I'm just asking, Amisha, well, I'll just, Amisha, have we, start my video, have we had any questions that specifically in the chat that we can ask? I want to, then I'll begin one. And that is for the culture teams, and indeed actually social prescribing. I heard, and I think I mentioned it to speakers privately, that GPs, a GP in my choir, I'll be specific, told me that he looked really despondent because he'd referred patients to arts because they were for depression, but he wasn't getting any feedback. What would be fantastic is if the arts organisations actually formally linked, as per thriving communities, with local PCNs, so that the GPs could really see the value that their referrals to their link workers and indeed link workers, very busy link workers, because you've been telling us the wonderful work that you all do, Lisa, but we know that I think you have 300, each link worker is responsible for something like 30,000 or 50,000 patients. And so we need a little bit of training, I think, in feeding back to the GPs the real value of your magnificent programs. I don't know if anybody wants to sort of speak on that subject, how you feed back the parties,
I can reflect a little bit about a partnership that we have got with a surgery that is not specifically with related to older people's work, but we have a partnership with a GP surgery, and we are exploring our relationship. It's surrounding health inequalities, and how we're working together with a GP who is got some trailblazer funding to really formalize those referrals. And I think that has gone a step further than social prescribing, because it's really created a partnership together with Glasgow University, this surgery, and the Playhouse, which is a model that is really interesting, and it especially looks around health inequalities amongst young people. But obviously that is a model that can be working for all ages, and I think this is the way forward, that with this trailblazer funding, where a GP gets a day a week to figure out how partnerships with health and the cultural sector can work. So I think that's pretty extraordinary, that, the time of a GP gets one day a week to kind of develop that. But that's still, that project's still really much in development, and I don't lead on it. So I'm not an expert on it, but yeah, that's an example of how I think we are working towards the future in partnerships. I don't know if that helps.
Thank you. I've got a question from the floor. Anna Briggs asked, do any of you organise activities targeted to BAME elders? And I know this is a particularly difficult area. I've recently worked with the Race Equality Foundation, trying to reach out to South Asians in particular, because we know that we're just not getting it right in this group in dementia. So does anyone want to pick up on that? I'm sure the answer will be yes from several of you.
Well, in Leeds, for example, they have the Leeds Black Elders. In our report, we list some of the wonderful BME. I'm always reluctant to use that term, actually. I'd rather say ethnic diversity or inclusivity or whatever. But I mean, many of these organisations, many cultural organisations, run their own activities, and the thing is to link in with them, for the arts organisations to link in with them and try and perhaps partner with them.
Yeah, I thought I'd jump in just before, because unfortunately I have to go slightly earlier. Apologies, but I thought I'd jump in just to say that we don't. Our project isn't targeted specifically, but obviously we reach out to community organisations or groups in particular who work with particular groups to kind of encourage them to join, and that's an ongoing kind of building relationships with groups in the community. But we've got a writers group for Black people, and that's for all ages. So members of our elders company have also joined that and joined that, working with younger writers. So we try and refer. We also try and refer participants to other opportunities. But yeah, it's an ongoing building those connections and spreading the word really in our community for us. Yeah.
Thank you, David. And I think you're right to pick up on the terminology, Veronica. It's a minefield, isn't it? Getting the right terminology, because you just think you're getting the correct one and it changes. So we were recently sent around from NHSE discouraging us from using the term BME or BAME, but unfortunately without a suggestion as to what we should use instead. And I remember the first conference I spoke at, I talked about people suffering with dementia and got roundly castigated because that's not a phrase that people in that field like to use. We will have to talk about people living with dementia. So, yeah, but more important is the substance rather than the phrasing we use, I think.
Sorry, go Andy.
You wanted to come in.
I was just going to say that in terms of our recruitment and referrals to our projects, it's an area of diversity that ethnic diversity is an area that we can do a lot better at. And this year we're running a project called the Dream Project for African and African Caribbean diaspora people, older people, which is a specific project that is led by an older Black artist. And the hope is that at the end of that project, some of those people will have had a safe, embedded experience with us, and then feel more comfortable and willing to access some of our other programs. And if the model works, it might be something that in future years we focus on different sort of global majority communities who we aren't seeing in our access our programs. So yeah, we're at the early stages of that.
And somebody else was going to come in, I think.
I was just gonna come in briefly, but Andy, that sounds amazing. I'd love to hear more about the Dream Project. That sounds fantastic. I was just going to say that I think what I've always been reluctant to is to become about kind of recruiting people just to make our programs more diverse. So I've always been kind of like the targeted thing is not about just making us look more diverse as a project. So the most successful projects that we run is like kind of similar to what Andy was saying, is that about partnership working. So the most successful project is that we work with leaders in that community, and that it's a mutual exchange of what we're offering but also what they're offering, and it's not about us kind of parachuting in and saying, oh, please come to this project, but seeing what we can do to help. Because I think we have a duty as cultural organizations that majorly are white led in this country, to see how we can be better providers of culture and arts and creativity for communities that do not feel traditionally represented in this community, in our cultural settings. So I think it's really, we need to do a lot better. The Playhouse needs to do a lot better. I think the sector needs to do a lot better. And I do think that the experts are in the partnerships. But yeah, similar as to what Andy was saying, I think we have to do better, and we have to develop, and we have to create meaningful work that is accessible, and not just about upping our equal opportunities monitoring forms. I think that's the long and short of it.
And also, just to add on to that, it actually makes us stronger as arts organisations, because it makes the work more interesting and more representative and richer. And I think, yeah, I definitely think that's the way to approach any form of inclusion and broadening reach.
I'd welcome comments from the audience on this. I think it's a really important point. So if anyone wants to pop up on video and speak, lots of you are putting comments in the chat bar, but nobody's, as far as I can see, putting their hand up and appearing on video. Unless that's
Peter, might I make a point?
Please.
Yes. Just wanted to say that at Arts and Dementia, we run an early stage dementia awareness training for arts facilitators. And we have long recognised the importance of there being community arts opportunities, workshops and so on within ethnic minority communities, led by people who, as might be said, look like the people from the community. And it was very hard to get people coming to training from those communities. And we now run an ethnic minority initiative which enables people to attend this full day training specifically for arts facilitators or working with people living with dementia, to attend at a very profoundly discounted price on the already subsidized program. And after leading or assisting in 2 community sessions, they can get that fully refunded. So we would like to sort of push that and let people know within the communities of this opportunity.
Thank you. And I'm told Nigel has his hand up. I can't see it.
That was me.
That was you, Nigel.
Sorry, I'll get rid of it.
Sorry, no, that's great. Sorry, I can't see you. I don't know if there's some technical issue, but I'm not able to see anybody except the speakers on my screen. So if anybody is frantically waving a hand out in the audience, just chip in, please.
We'll remove the stop button.
Shall I suggest if anyone wants to talk about transfer, sort of moving from drama for creative aging to post-diagnosis, the kind of how the ease of transfer, because I know that, for example, at Leeds, the drama is very different. I remember when I went up there, it was made very clear that the drama for older people as creative aging was very different from the drama for drama post-diagnosis, and certainly it is. And it was following on from what Nigel just said, it was hugely moving to feel that it was being these programs were being co-curated or interview based, and really exciting. So it'd be very good to know, particularly for the prescribers, how a patient, for example, person who's got early symptoms of potential dementia. I mean, what I would like to say also on this is that if people are referred early to preserve their brain health, and they're doing it while they are having memory assessment, this will preserve their confidence, and then by the time they've got their diagnosis, they'll know that why shouldn't they continue to do these wonderful drama programs. And if, of course, the diagnosis turns out not to be a dementia, the engaging aspects of your fantastic drama and other programs has been good for their cognitive, for their good for their brain. And but it'd be very interesting to know a little, as we've got lots of lovely time now, I'm sorry to sort of hurry people, to know if you want to talk about, if any of you drama leaders want to talk about at what stage and how people transfer to your post-diagnostic programs. That would be very interesting.
And if I can just chip in, I think we're sometimes guilty of feeling that people with dementia can't do things, and that's absolutely not the case. Anybody who's been moved by Paul Harvey composing on his piano with quite advanced dementia will know that. And I was lucky enough to be involved with the Restaurant That Makes Mistakes, the Channel 4 program, where people with dementia were running a restaurant. So absolutely, people after a diagnosis can still lead very full lives. Anyone want to chip in on that?
Well, Sheila, do you want to? Oh, is that? Sorry, Tom.
Sorry, I saw a hand. How exciting!
That's okay.
Tom Watkins. Is that Tom Watkins? As in the, yeah, no, not Tom Watkins, the MP.
No, unfortunately not. I'm the East Region lead for the Thriving Communities programme at NASP. But it's lovely to be here today, and this session brings together several of my very, very dear passions. Firstly, social prescribing and well-being in general, drama, which is very dear to my heart, and good dementia care. And I just kind of wanted to sort of summarise some of the thoughts that occur to me right now, which is that I think that drama is kind of uniquely placed, really, to help support people from ethnically diverse communities sort of navigate their time either pre or post diagnosis, because for some people, for certain members of communities, it can be quite difficult to cope with the stigma of a diagnosis like dementia. And I think, drama being what it is, can help people to express that in quite a meaningful and powerful way for people who may otherwise struggle to explain and come to terms with that because of their cultural identity. Okay. So I think this is really important work.
Thank you, Tom. It's really good to hear. I was hearing some noises off, so if you're not speaking, I'd be grateful if you could mute, please. And I've noticed quite a few people having to leave. In the current world of Zoom meetings, everything rolls on every hour. Okay, we've now got somebody's phone going off.
I'm going to have to leave, and Veronica's asked me to speak to the last question. So I think the only thing I really wanted to add was it's fantastic to hear about all of this work, and I'm so looking forward to learning more about it. I think very specifically, Veronica asked us to speak about that pre-diagnosis period. I think for me, a lot of the work I did and sort of correlated in the book was about a sort of a public-private continuum, and how this work is presented very much along that continuum, and the private very much being, you know, within sort of either small group sessions, or I know we're asked not to speak about care situations, but that there are those sort of elements between the public and the private. And I think all of the health benefits that have been talked about today are really important, but I think also really important is a sense of visibility and space to be present within arts practice and seen as viable creators and artists in and of themselves. And I think that's one thing we haven't really touched on, is that, you know, part of this work creates visibility. You mentioned, Peter, the television show, the restaurant, for example. I think it's really important to say that, you know, although this stuff does happen privately within the workshop space, some of the material is presented in a public forum, and all that can do is provide more visibility for a group in society, whether we like it or not, that is much more marginalized than any other age, you know, youth, children, middle age, whatever else. And I think that's a really important element that perhaps we should think about more, is how do we, as facilitators, as researchers, as academics, how do we point to a lack of visibility? You know, we don't see older adults, we don't see old people in the same way that we see people of my age and younger regularly. And I think that's part of a broader question around marginalization. We're talking about marginalized communities, and how do we encourage them to access you know, our arts and arts practice. I think in and of itself, this age group that we're talking about is marginalized. So anything that can create more visibility around the sort of issues that they deal with regularly, I think is really important politically, culturally, socially. So I think that's the other wonderful aspect of this work. Yes, it creates a health benefit and allows people to age in a better way. And I know there's been lots of terminology that's been thrown around today that's been really helpful about things that are appropriate and inappropriate. But one of the things that I think is most inappropriate about our society is that for some reason we hide a particular group within that society, and we don't allow them to be visible, and we don't highlight their activity within our society. And I think this is one of the kind of practices that's so wonderful about this work, is it also makes people seen and presents them and allows them to be less othered. And anyone that's othered in society has a huge, you know, burden to carry. So I think that's one of the points I wanted to make really about the practice. Probably not necessarily related to what everybody else was saying, but I think it's certainly what I'm very interested in, is the kind of political aspect of this work. So just wanted to say thank you for inviting me, Veronica. I'm going to have to go, but I really enjoyed it. So thank you, everybody. And thank you for inviting me again, Veronica.
Thank you, Sheila. And a really powerful point, very well made and very important. So absolutely. I think that's a good point to finish on, actually, because I'm aware people have got other meetings that they've got to go to. So can I hand over to you, Veronica, for the last word? And for me, this has been a very exciting morning. I could have listened to all our speakers for about 10 times the amount of time that they kindly stuck to. And it feels like we've sort of set ourselves up for another meeting in the near future. But over to you.
Thank you, Peter, for your absolutely superb chairing. Many apologies to everyone on the call, because I need to be better at technology, and I promise, Sue, that I will not do that again. I've got to learn how to send out a Zoom invitation to everyone and the same one to speakers. I'm terribly sorry about being so bad at that. really promise to do better. Your talks today, your questions have really been eye-opening. I'm so grateful for every angle. Actually, one participant, Rona, who we've known over the years, pointed out that we hadn't got captioning. I must find out about that too. But it was particularly wonderful to have the inclusivity and the lack of othering that will now be in our transcript. So thank you very, very much. All the points you raised, we'll try and follow through with your links, and do keep in touch with us. We shall now do actually, I'm just going to finish the recording. How do I do that? Stop recording.